numbers, maybe they explain things really fast, and you're just overwhelmed.
Totally. Trying to piece it all together. It happens all the time.
Exactly. And you walk away thinking, did I really get that? Do I actually understand what's going on with my health or what I'm supposed to do? It's such a common feeling.
It really is.
So our mission for this deep dive is to kind of pull back the curtain. We want to explore how medical centers actually make sure you don't just get handed information, but that you truly understand it.
Yeah, that understanding part is key.
We're looking at the meticulous, often unseen world of patient information and education, specifically through the lens of the NHRA Accreditation Standards. NHRA is the National Health Regulatory Authority.
That's right. And these standards, they provide a really detailed framework. Think of it like a blueprint for how medical centers are supposed to handle health information. It's not just about accuracy, though that's vital, obviously. It's also about making sure it's delivered effectively and, crucially, that you, the patient, actually understand it.
And our source for this is that official document, right?
Yep. Directly from the NHRA Accreditation Standards for Medical Centers, Edition 2, V 6, dated November 2023. It really gets into the nitty-gritty.
Okay, let's dive in then. At its heart, why is patient education so fundamental in healthcare? Why is it so important for you, listening now, to be really well informed about your own care?
Well, it's interesting how the standards frame this. It's not just a vague education is good idea. Element 12 specifically talks about the roles and responsibilities of everyone involved in educating patients. That includes during a hospital stay, but also, really importantly, for people managing long-term conditions.
Right, ongoing care.
Exactly. And the goal isn't just shoving facts at you. It's about providing current evidence-based information on everything from treatments to general health promotion.
And you mentioned something about monitoring.
Yes. Critically, they emphasize monitoring of outcome from education activities. It's about checking if the education actually worked. Did it stick? Did it make a difference to your health?
Okay, that's huge. It means they have to track whether it's effective, not just deliver it. Okay, so the why is clear empowerment, better outcomes. Let's talk practicalities. What kind of information should you expect to get, especially before treatment?
Right, before you even agree to a procedure. The standards are quite specific here. They say clear current information materials must be available.
Materials like what? Leaflets?
Could be leaflets, yeah, or booklets, digital info, whatever works. But the key is the content. They have to help you make informed choices.
Informed choices, meaning?
Meaning they need to clearly explain what the procedure involves, what your other treatment alternatives are, the possible outcomes, good and bad.
So the risks, too.
Absolutely. It has to cover general and procedure-specific risks, and even spell out possible complications and side effects. It's about full disclosure upfront, no same raises.
That sounds incredibly thorough. But, medical knowledge changes so fast. Where do these resources even come from, and how do they keep them from getting outdated? Is there, a system?
There has to be. And that's another sort of hidden layer, the standards mandate. Quality control is vital.
So how does that work?
Standard 12.1.5 requires a database of all patient education resources used in the medical center.
Essential database, okay.
Exactly. It's not just random stuff pulled off the shelf. This database is the control point. And a lot of these resources, the guidance notes, are produced by real specialists. Think Royal Colleges, top academic institutions.
So high-quality sources.
The best. And crucially, there have to be checks made to ensure that the most current information is available. If something's outdated, there need to be mechanisms in place to correct this as soon as possible.
That's reassuring, constant updates. But
Yeah.
okay, you have this great current info. How do they make sure it actually connects with me? Or you? Or anyone? People learn differently, come from different backgrounds.
Yeah, and that's a huge challenge. It can't be one size fits all.
So how do they tailor it?
Well, the standards address this directly. Standard 12.11 talks about resources for staff, and 12.1.4 focuses on culturally sensitive resources for patients.
Okay.
The core idea is that resources must be based on patient and family needs suitable to the type of education and for whom it is delivered.
Can you give an example?
Sure. For kids, maybe pictorial guides or role play, depending on their age. For adults, it could be leaflets, booklets, media, or even practical demonstrations like how to use an insulin pen.
Right, practical skills.
And really importantly, resources must address the different cultural beliefs and values of the population served. This could mean materials in different languages or just being mindful of cultural perspectives in the content itself. It's about meeting people where they are.
Makes sense. It's one thing to have great materials tailored and all that,
Yeah.
but delivering them effectively, that's down to the people, isn't it? The human element.
Absolutely.
So who is actually responsible for doing this education? Is it just whoever's around, or is it more defined?
It's very defined. Standard 12.1.8 is clear. Each staff member with responsibility for providing patient education and health promotion has their role documented in their job description.
Wow, okay, so it's an official part of their job.
Yes, including the specific knowledge and skills required. It signals that patient education is a core responsibility, not just an add-on.
That's good to hear. But having it in the job description is one thing. How are these staff members actually, trained to do it well? Especially with diverse patients, sensory impairments, kids, older adults. That requires real skill.
It does, and the standards demand proper preparation. Standard 12.1.9 says staff get training on effective education delivery before they're even assigned the role.
Before they start.
Yes. It's part of the center's main training program, tailored for different professionals, nurses, doctors, dietitians, whoever is doing the educating.
And what does that training cover?
Crucially, it includes how to communicate effectively, covering specific techniques for patients with sensory impairment, children and adolescents, the elderly. It's quite specific.
And do they check if the training worked?
They do. Standard 12.1.9i mentions that staff are assessed for their competency, often by observing staff carrying out patient education. And if needed, they get update training. It's about ensuring they can actually do it effectively.
Continuous improvement. Okay, so they're trained and assessed. What about the specific communication techniques? Beyond general skills, are there particular methods they're supposed to use, like a playbook?
There is kind of a playbook, yes. Standard 12.1.7 requires documented guidelines for staff to follow that includes techniques for effective communication and education.
And what's in these guidelines?
Practical stuff. Things like how to deal with language barriers, using suitable language, avoiding jargon so the patient and family can understand. Also, importantly, allowing sufficient time for people to absorb the information and ask questions. Really interact.
Time is so often the issue, isn't it?
Yeah. It is. And these guidelines aren't set in stone. They're meant to be updated with feedback and input from staff, making them practical and relevant.
Okay, this is getting really interesting because you can explain things perfectly, the guidelines are followed, the patient nods. But how do you know they've actually understood, not just being polite?
Yes, the polite nod. That's where a really powerful technique comes in, mandated by Standard 12.1.11.
Which is?
Staff use teach-back techniques to check that the education has been understood.
Teach back. What's that exactly?
It's simple but effective. Instead of asking, do you have any questions, or do you understand, you ask the patient to explain it back in their own words.
Oh, I see.
Like, okay, just so I know I explained that clearly, can you tell me in your own words how you're going to take this new medication?
That shifts the responsibility.
Exactly. It puts the onus on the educator to ensure clarity. There's also the show me method for skills like show me how you'd use your inhaler.
Brilliant. Active confirmation. So once you've used teach back, confirmed understanding, what happens then? Does this get recorded? And how do they track if the education actually works long term?
Good questions. Yes, it gets recorded. Standard 12.1 requires that the health education and the response understanding is recorded in the patient clinical record.
So it's part of your official medical history.
Precisely. And it's included in routine audits. Then for tracking effectiveness long-term, that's Standard 12.1.13. The health education is evaluated for its effectiveness.
How do they evaluate that?
Several ways. Patient feedback, analyzing health record audit results, looking at data on non-compliance.
Non-compliance like?
Like, for example, an unplanned admission to hospital for failure to follow treatment and self-care plans. That's a strong signal the education perhaps didn't land effectively.
Wow.
This is especially crucial, the standard notes, for long-term conditions such as diabetes, hypertension, hypercholesterolemia, etc., where self-management is key.
That makes total sense, linking education effectiveness to actual health outcomes, like readmissions. Okay, so beyond specific treatments, are medical centers doing anything broader, like promoting general health through education?
Yes, definitely. And this is actually highlighted as a newer addition in these standards, showing that shift towards proactive care.
What does it involve?
Standard 12.1.3 mandates that the medical center provides a range of health promotion support initiatives.
Initiatives like,
The guidance gives examples like specialist clinics for things like weight loss, smoking cessation, healthy diets, or even well baby clinics. It's about supporting overall wellness, not just treating illness.
so it's a really broad approach, covering specific conditions, general health, ensuring understanding. How do they tie all these different threads together? How do they standardize this across a whole medical center?
Through policies and procedures, as you might expect, Standard 12.1.6 requires clear policies and procedures to implement a standardized approach for all patient and family education material.
What do these policies actually do?
They guide staff on how to assess your specific needs and learning abilities. Sometimes they use tools like flowcharts or decision trees to help staff navigate the process consistently.
Makes it systematic.
Yes. And ideally, these policies aren't just written by administrators. The guidance suggests they should be developed by the multidisciplinary team involved. Doctors, nurses, educators, pharmacists, all contributing their expertise.
A team effort. Okay. This deep dive has really shown just how much thought and structure goes into making sure you, the patient, are properly informed. It's way beyond just handing over a leaflet.
Absolutely.
We're talking carefully created resources, staff trained in specific communication skills like teach back, constant updates, cultural sensitivity, and even evaluate if it all works. It's a whole system designed to empower you.
It really is. The complexity outlined in these NHRA standards is fascinating, and it underscores just how vital this process is. It's all about creating an environment where you don't just hear the information, you truly understand it and can act on it for better health.
So, thinking about how fast medicine evolves and how diverse patient needs are, here's something to ponder. What might be the next big step in patient education for medical centers? And maybe more importantly, how could you play a role in shaping those future improvements, making healthcare even clearer and more empowering for everyone?